Hello, everybody. My name is Dr. Irfan Khanbhai, and I'm the program director for the UBC Psychiatry program. My sincere apologies that I'm not able to be there for the meeting today. Something called me away, but I really am happy that this biannual meeting is getting underway yet again. It's fantastic. I wanted to give you some updates on what's happening within the program for the last while. I think the most exciting news that we have is that the Ministry of Health has supported funding for a new track in the Southern Interior. We will, starting in July, have two new positions through CARMS, and that will be funded repeatedly as we can sort of have residents there. This year, we actually have a reentry resident that started there, and that's given us the opportunity to ensure that the infrastructure is in place and ensure that we have the clinicians who are so excited to teach in the Southern Interior try to get their feet wet. So that is one important piece of news. The other piece of news is that the Ministry of Health has also confirmed some funding for two new re-entry return of service positions. What that means is that other specialists or family physicians within British Columbia can apply to those positions, and they would be able to train as psychiatrists, which is really exciting. Those positions will be based in, one will likely be based in Vancouver track, and the other will likely be based in the Fraser track. And then they will be doing a return of service of 3 years somewhere in an underserved area of the province. So those are really important things in terms of program expansion. The next thing I wanted to speak about is our wellness committee. We're really excited about the tremendous work that our wellness committee, chaired by Dr. Ken Heng, has been involved with over the last couple of years. They've had many initiatives. I guess the most important one, which we have utilized in the program to improve, is the annual wellness survey. We have had our second annual wellness survey and are waiting for the results, and we'll base improvements on the program depending on what the results are. Some of the initiatives that came out of the previous annual wellness survey is a resident advisor role, which is a role where residents will have somebody to be able to talk with that's arm's length from the program, not related to the department, who can advise residents in anything that they would like to sort of get guidance on that's non-clinical. And then from a clinical perspective, we are going to be shortly starting a clinical consultation group for residents that are interested once per month. And that's getting underway, and we have many expressions of interest from many of you with regards to running that group. So that's very exciting as well. Another initiative that we're really happy about is introducing mandatory sannyas training for all our PGY2s. That's happened as of this past October, so this month, and the residents are really immersed in it and really having an incredible experience learning about being very culturally safe with our Indigenous patients. The second last thing I wanted to mention was how CBD is going, our Competence by Design curriculum that rolled out. It's now 3 years ago. So we have our first CBD cohort in PGY3, which is very exciting. And over that time, we've had a number of workshops and webinars to support you as faculty to help engage with these work-based assessments that are required with our teaching residents. And if those are still, if there are still questions regarding the CBD curriculum, we're happy to field them, either Dr. Charles Ho, who's our CBD lead, or myself. And on Entrada, there's a number of webinars that faculty can watch for continuing education points. And then the final thing that I wanted to mention is that our academic day has been completely revamped. This is in response to how the Royal College exam is now going to be for the new CBD curriculum and cohorts happening in PGY4. And so what that means is that we took the opportunity to really reevaluate our academic curriculum, streamline it, remove redundancies, and try to fit it into 3 years so that the PGY4s have time to study. And the other thing that we were able to do is incorporate quite a bit of flex time so that residents have a little bit more opportunity to complete uh, their Royal College requirements that don't have enough protected time in the program. So thank you for listening to me. I'm very excited to tell you about all these things. We'll have lots of new initiatives coming down the pipeline for the next year, and I will be able to speak to all of those next year, hopefully in person. And thanks so much for your attention. And if there are any questions, please do not hesitate to email me or give me a shout. Thanks very much.